Arora sitting next to me. She is the managing director and CEO of Yasa Hospital, and she has a lot of achievement attached with her name. So I think words would be less to define them right now. So let's jump up straight away to the questions. So ma'am, specifically in the hospital industry, we aren't seeing much females. We were not seeing मतलब बहुत ज़्यादा females काम नहीं करती थी, बट अभी हम देख रहे हैं कि एडमिनिस्ट्रेशन में, ऑपरेशंस में बहुत सारी फीमेल्स आने लगी हैं. तो आपको क्या लगता है, व्हाट इज दैट वन थिंग दैट हैज मोटिवेटेड हिम?
So first of all, if you see the data, 50% workforce is female in healthcare because nurses are generally females, and different kind of doctors like gynecologists are generally females. But still, if you see, to reach to top, females are reaching to a certain place, middle management level. Yeah. But if you talk about CEO level, then you hardly find. If you are going and you search on Google that how many CEOs are available in the healthcare industry, I think not more than 10 to 12 names. What I am telling you, if I am, including all other hospitals also, not only India. I don't know, there is still glass ceiling. Reason behind is that we are supposed to, deal with the very senior doctors, senior neurosurgeons, cardiac surgeons, but now things are changing. As you can see that there was a time hardly any female was coming out of the house and working. But if you see, today I was just seeing the gathering, 50%, more than 50% were females. But still I am finding, yesterday I was in West India, and there was a panel discussion. I was the only female who was sitting in center, 3 male were this side and 3 males on that side. So I don't know why this is mindset that females cannot take big responsibilities. But it's now our turn. I am just including all the females that they have to prove. Yes. But for that they have to work. If you are all the time telling excuses, now I am married, now I am pregnant, now my mother-in-law is not well. So that is how people are not ready to take females on higher position. They think they will all the time give some excuse. So if you are professional, you need to be professional.
Exactly. So well said that exactly everybody has to be professional. I think personal life is as important as professional life. Yes. But both of them should be balanced somewhere. So आजकल अब हम टेक्नोलॉजी की बहुत बात करने लग गए हैं और हम डिजिटल हेल्थ की बात कर रहे हैं. So what according to you is one of the best technology that has happened in the recent times? Like अगर मैं बोलूँ तो मेरे लिए wearables है कि हम आज हमारे पास घड़ी है, हम उससे day to day monitoring करते हैं. So according to you, which is one of that innovation?
There are many things, but because I belong to a hospital and I run a hospital, so if you talk to me regarding something in healthcare, so I will say this robotic surgeries are very, very good thing, and it's a blessing for the patients. Because now it's very small incision, no blood loss, and patient is getting recovered very soon. So now AI is also taking very big place in healthcare. But right now, if you see that robotic surgery is very good technology which somebody has discovered and made. Same time, there are few early warning sign devices are into market. So these things are very helpful for patients. And as a healthcare provider, for me, patient is the most important person. So I think these days everything is just roaming around internet, and health care is already into this new technologies, new innovation. And whosoever invented internet, I don't know his name or her name, but it's a very blessing in disguise, because blessing who are doing something good, who are doing some innovation and research, but disguise for those who are actually misusing this. But definitely AI is also a blessing for everyone.
So I know you have a busy schedule, but the last question for the session that I read that you were recently working with medical tourism, and I think you have been appointed as the committee member of medical tourism. So how do you see medical tourism going ahead in India? Like, what is the future of medical tourism?
Actually, I was chairperson for the Service Export Promotion Council. I was chairperson for the healthcare division. So all medical tourism comes under that, and all services which we are providing to different countries. Same time, I'm chairperson for FICCI, Medical Value Travel. You can see a drastic change in Indian healthcare. There was a time when only Indian people were even going outside, not taking in here treatment. They were just, if somebody is having money, they are used to fly America or London or somewhere. But nowadays, even in my hospital, you will see that 20% of patients are foreigners. And I am not talking only about Bangladesh or South Africa. There are different countries, like we have a tie-up with NHS and BAPU. So we are getting patients from London also. Why? Because India is providing best quality care, plus affordable prices, plus holistic healing. We are not only treating in medical and modern science. We are dealing with some yoga, some Ayurveda, some Unani, some different kind of therapies also, naturopathy. So what I say, Indians are less interested in naturopathy and Ayurveda. Foreigners are more interested in all these things. So this is the USP of India. India is going to be the biggest, medical tourism hub, because it is our Prime Minister's dream also. Honorable Prime Minister wants to make India as a hub for medical travel.
So that was a great session. So as we come down to like wrapping up the podcast session, I would just like one last health advice that you would like to give the young generation, specifically, that what should they focus on and how they should look at their health.
So luckily, I should say these days kids are more kids. I mean, I am not talking about 10 or 12-year-old. Young generation is quite aware about their health.
Yes.
And I can see that they are more into healthy food,
Yes.
and they are going gym and they are doing yoga, running. So I would like to tell everyone, don't become a lazy boy and sitting on the couch and eating potato chips. You need to be active at this age. And if you see Dr. V.K. Singh, he is such a senior person, but he was also very active.
Yes.
So anyone who is doing a disciplined lifestyle, he can work better than others. And same time, for young generation, don't go for drugs, don't go for alcohol. Just do yoga, meditation, and take care of your health. Eat healthy.
Thank you so much, ma'am. It was great hearing from you. I mean, I have a lot of more conversation that I could do, but I think you are at the time constraint, so we'll continue with that later. Thank you so much. It was
मैं
great.
हमेशा कहती हूँ, स्वस्थ रहेगा इंडिया तभी तो आगे बढ़ेगा इंडिया. स्वस्थ रहें, खुश रहें.